right, everyone. So yes, so we are going to skip the open Q&A, seeing that the skies have had opened and have seemingly stopped and are going to start again. And we obviously have some traffic we'll all have to work through. But we're going to, in this final session, go through, I think, one of the more underrated but incredibly important areas when it comes to taking care of patients with rare neuroinflammatory disorders, which is family planning, and also as some of these conditions can span the lifespan, what is it like transitioning from childhood to adulthood, and what does that look like? So why don't we start with maybe some introductions from our panelists, and we'll dive right in.
Hi, my name is Michelle. I am 30 years old. I've had NMO since I was 14 months old. I was officially diagnosed in 2017.
Hi, I'm Dr. Kate Otten. I'm a pediatric neurologist, so I see patients up to age 21 at Seattle Children's Hospital in our neuroimmunology clinic.
Hi, I'm Annette Wundes. I'm a neurologist at the University of Washington. I see patients who are adults and with MS, NMO, Spectrum's disease, and the other conditions we discussed today.
Excellent. So I think, Michelle, if you don't mind, I'm going to start with you because your story is so remarkably unique. I remember we had the chance to have a conversation really months ago about this particular session, and I think what's remarkable is you've obviously dealt with NMO as a child, and also having your parents as essentially your care partners, but you also have a little one of your own. And so I was wondering if you could share with us a little bit about your story, about what that was like, and then I think from there we can maybe ground our conversation in your own experience.
Okay, so to kind of give like a brief explanation, at 14 months old, I was paralyzed from the waist down. At the time, they told me I only had transverse myelitis. Fast forward to 11 years old, I had another leg symptom. I was in Oregon on vacation with my family. They said, put some steroid cream on it. It's another flare from transverse myelitis. Go home. Okay. 13 years old, I'm running on track. I pass out. We go to Children's. They tell me, you have a brain tumor. They retract that, and then they said, you have optic neuritis. You could go blind one day. Have a nice day. And that's all we knew for a very long time. I turned 21 in 2017. I started getting paralysis on my left side from my waist down. I felt my complete left leg go all the way numb. Was in hospital for about a week, only doing IV steroids. And then they told me at that point, you either have MS or you have NMO. And I now go to the MS clinic through the UW. My provider is Gloria von Gelderen. And when she had told me, hey, you have NMO, I was relieved that I had it. And I was like, what's next? And at that point, it was, can I have kids? Am I going to be able to have kids? She goes, absolutely, you can have kids. We just have to plan. And so she said, what was your time frame? What was your plans before getting the NMO diagnosis? And before I even found out I had NMO, I was like, oh, a nice time frame to have kids would be like 25. I would probably want like maybe 1 or 2 if I'm lucky. Twins run in my family, so 3 max if that happened. And then the 25 came and went, and I was like, I don't know if I'm ready to start trying to have kids. And by the time that me and my husband finally got married and wanted to actually actively start trying for kids, it was okay. Let's start talking about high-risk doctors for OBGYN. I got referred to a wonderful clinic here in UW called MICC. And, I did all the pre-planning, let's talk about it. And from there, by the time I finally was able to get pregnant, it took me about 3.5 years to get pregnant. That provider that I saw that I loved, that I did family planning with, was no longer there. And then I had to try to navigate to find somebody that I liked. You know, went through half my first pregnancy and found Dr. Simmons. And I like to tell everybody, if it wasn't for Dr. Simmons, my OBGYN, and my neurologist, and the amazing UW care team that I have, PCP all the way through, I would not have my kids. So,
I can tell how much they mean to you, just hearing that love in your voice.
I think there's so much to unpack there, and I really appreciate Dr. von Geldren's question to you of what were your goals before this diagnosis, and that fundamentally, I mean, across all of these conditions, that's what we're hoping for, right? Is to be able to give people their life back and to get them back to what their goals were before they received this life-altering diagnosis. I mean, there's so much to unpack, but I guess we'll start from the childhood aspect. Dr. Otten, I'm curious what stood out to you from Michelle's story, and what challenges you face as somebody who is making these diagnoses and managing these patients as children that might stand out as opposed to managing adults.
Hearing you say how early you were thinking about being a mother someday and wanting to know early on in your diagnosis what that would look like, I think also hits home. That comes up for me in two sides, because I'm typically meeting with the child and with their parents, and both of those folks have different visions, sometimes the same vision about what that child's life is going to look like. But almost always there's that question of, well, I know my 13-year-old isn't going to have a child now, but I want to know if that's going to be off the table. I want to know if that's going to be on the table, even though that might be 15 years too early to have this conversation. It's there. And so I've learned from patients now that I bring it up early on, sometimes even in the first visit, to talk about, hey, there are a few things that patients often want to know, and this is one of them, because I think it's a hard thing to ask about sometimes when you're already trying to think about what new treatment am I going to be on? I just got this new label. I've got 8,000 other things that my doctor seems to be prioritizing. Should I ask that now or not? So now I'm trying to answer that sooner rather than later, because everyone wants to know what impact this will have on their future, and those big important things like family are so meaningful. I think being a pediatric neurologist is a very specific situation in that I'm often meeting with folks, you were diagnosed as an adult, but you had experiences, relapses as a child, as an adolescent too. And I think it's really hard to navigate with an adolescent that transition from being taken care of to taking care of myself, partnering with my parents, of course, but learning to meet that child where they're at in terms of their understanding of their disease and their ability to understand what's going on for them, and then try to guide them towards, as they leave my care, to navigating as much as they can on their own, but also figuring out with them who are your support folks going to be, because no one should have to do this entirely alone. Nobody at any age wants that, but we do want to empower our patients to feel like they're capable of making decisions with everyone in their life that matters to them.
I'm curious, this may be a question for both you, Dr. Wundes, and Dr. Otten, is you mentioned that transition and maybe building those skills for patients. And I'm curious for each of you, as as a patient is perhaps planning to transition out of your clinic, Dr. Otten, or Dr. Wundes, as somebody, as you get a young adult entering into your clinic, are there certain skills that you find that you need to focus on with patients for that, that self-efficacy, so that they can take ownership of their condition?
In the last decade, we really recognized how poorly we were letting our patients down by not helping them with that transition. And we now know that transition's really different than transfer. They're going to transfer care from me when they get to a certain age, but transitioning is a much bigger umbrella. And we now know the American Academy of Pediatrics recommends that we start that conversation before the age of 13, actually, to start putting out there that, hey, we're going to work on skills so that by the time you do transfer care, you feel ready to do that, and that we'll do this together, and I'm with you for that. This isn't going to be a see you later, you're 18 now situation. But it definitely takes multiple visits, and we have a number of resources now that we use, including a checklist that has skills on it that I want to work with patients to try and master. And we have questionnaires for both parents in our clinic and adolescents in our clinic to see if they feel ready for these different skills. And those skills can be things like, do you feel confident that you can name your doctors and know why you would call them and what you would call them for? Do you know when you should go to the ER, especially if you're, say, graduating high school, leaving home, maybe starting a job or going to college? You can't ask your mom and dad as readily, and so do you feel confident that you know what you would do and what an emergency is? Do you know how to get your refills? Do you know how to get to the pharmacy? Can you name all your medicines and your allergies? And can you name your condition and give a brief description to, say, an emergency room doctor so that they can be caught up on your history? And so there's now an established checklist we use in our clinic to try and help make sure that we're actually addressing the issues that a patient should start to feel comfortable taking responsibility for. But it's a lot. Adolescence is just a lot anyway, and having to do that with a chronic neuroinflammatory condition is just wild. So we try and do our best to work with them and make that transition as easy as we can. When I do transfer patients to an adult neurologist, we try to do that before they're 21 so that way there is overlap, so that if it's a good fit, great. I can still cover refills though until they really feel like they've fully hit ground in their next practice. And if it's not a good fit, then we can try again and we still have time, and that there's no point where they're out of medicine or don't have a primary neurologist that they can call. But it's such a journey. Adolescence is a tough time, and to have to be making those big changes is a lot.
I can only add to that I've seen very successful transitions. So I've seen very mature 18-year-olds coming into my clinic who have had to live with these type of conditions for quite some time and are very self-confident in that. So you seem to be doing a really good job there.
Michelle, I'm curious, what did that look like for you? I mean, did you feel like you were, when you transitioned, because, I mean, you were not just making this transition, but you didn't have an official diagnosis at the time. So I'm curious, I mean, are there lessons you have maybe for us as providers of, I wish that I had been better prepared in this way as I moved into an adult neurology practice, or anything that stood out for you?
So at the time that I was told that I had neuromyelitis optica, that was my last visit at Children's. They told me that I would possibly come back for yearly MRI scans to monitor the possible brain tumor that I had that they later retracted. But ultimately, my journey at Children's Hospital ended with, you're going to go blind one day, see you, I have to go to my next patient. And, my NMO medical journey didn't continue until 2017 when I did have that paralysis. And we actually, what you refer to as your as your transition sheet, my family calls it a medical cheat sheet, because we ended up making one on our own because there wasn't resources. It was just whatever we could find on Google. And so even to this day in my wallet, I have an updated cheat sheet of my neurologists, my providers, allergies, reactions, when my last rituximab infusions were. And it's actually been very helpful. Every time I've gone to the ER, whether it's in state or out of state, they're always like, hey, what's this? And I said, you know what, here, this is a little easier. And I unfold this piece of paper and they say, can I make a copy of that? I said, absolutely, go ahead. And if I'm out of network, they always make a copy of it. And everybody's like, everybody should have one of these in their wallet. And so to this day, even if we travel, we laminate it, we take it with us, and I make sure it's up to date. But really what I would like to applaud as far as children's goes, hearing the progressiveness that you've talked about, is taking the time to be able to talk to your pediatric patients and their families, and being able to, you know, make them feel more confident when leaving, and that the transition is going to be more smooth. Because going from, you know, 13 years old to 21, and they're like, are you sure this is what you had? And being questioned by doctors whether, you know, we were, you know, to put it quite bluntly, lying about whether I really had transverse myelitis or optic neuritis. And it's like, no, we did. And I would say to this day that if it wasn't for my mom keeping my medical file from, at the time, that's now Kaiser, it was Group Health. If she did not keep my medical file, I would not have gotten treatment that week I spent in the hospital, and would probably still be in a worse condition than I am now. So really just taking the time to listen, and even if it sounds strange, to take all the possibilities and even like background stories, even if it sounds like nonsense, and really just be there for your patients. Don't try to question it too much to where they feel like you don't believe them or that they're making something up when they're not.
I am curious about, you know, as you entered into this stage of life where you're thinking about family planning, you know, in NMO, it's even more complex. You know, thankfully, in more recent years, we've had a little bit more clarity, for example, with family planning in MS, and we have a bit of a better understanding of how the disease behaves over pregnancy and the postpartum period. Certainly, when you were thinking about starting a family with NMO, there was almost no information at the time. What was your experience like as you were, you know, entering into that, the uncertainty with that? How did those conversations with your providers go?
It was a little overwhelming at the first appointment that I had with my OB, because it wasn't like, hey, you're pregnant, you know, let's start talking through your pregnancy and your NMO. It was, oh, you want to get pregnant? I'm proud of you for taking the step, and, you know, wanting to get information to make sure that you're in the best position possible to have the healthiest pregnancy. Because that's what was most important to me, was what can I do to make myself the healthiest possible to have the healthiest pregnancies? Because I do not want to jeopardize what could be my future kids, because I just want to hurry up and have a family. Now, I do know that things are unexpected, like my second was very unexpected, but it's overwhelming. If it wasn't for the suggestion to, you know, just walk into the OB's office and say, hey, let's have a discussion of what pregnancy with NMO would look like for you. We could do all these tests to see if there's a possibility that you could genetically pass something down, if you're in the best health as possible, you know. And again, I can't say how thankful I am that through the UW, because all my doctors are through the UW system, how well they communicate with each other. And it was like, I was just along for the ride. My doctor was like, hey, we have a shared patient. She's thinking about getting pregnant. Can you send me her files? And it's like, let's all have a discussion. It was very group oriented. I always felt like it was like me talking with family, never me talking with doctors. And so even though it was overwhelming, it was calming and reassuring, because by the time that they said, I'm giving you the green light, go have kids, come back when you're pregnant and we'll take it from there, I was relieved that I can have a healthy pregnancy. It's possible.
Ask Dr. Wundes one of the more challenging questions, and I'm grateful that I'm not the one answering it. So, you know, it is already challenging enough to navigate, you know, the family planning conversation with a patient with, say, MS. But when many of these rare diseases, we have even less information to work with on, you know, what is the likelihood of a relapse during pregnancy or postpartum, and what to do about treatments. What is your general framework with when a patient approaches you and says, you know, I think we want to start a family? how do you approach that with some of these conditions that we've been discussing today?
I'm actually pretty happy to hear that Dr. von Geldern was, yes, you can have kids. Let's talk about how. So that's kind of like, I think, a very important piece to put a supportive environment in there. And kind of like, I think it reminds us neurologists also humble. It's not that we're thinking about only a diagnosis and a DMT, and that's the end of what we experience from your life. So there's kind of like, you come with your story, with your background, and you have a plan, and you have a plan for your life, whether that's professional or personal, and we want to make that happen. And then obviously, yes, in the NMO world, if I compare this with what I also counsel patients on with the MS world, in the MS world, we have learned a lot about pregnancy, but we can actually glean some items from that and take it to the NMO spectrum disease world as well. So you mentioned your drug, and that's a drug we have a lot of experience on in terms of pregnancy. And so kind of there are some newer drugs, which it's really harder to get some information. Even reputable resources give you conflicting information, and there's very little information out. But I think that this is also a question of time, and there's supportive data for both pregnancy and breastfeeding coming out, but it's in small numbers at this point.
We're already, running somewhat low on time. So I think I have a question for our two providers, and then I have one more question for Michelle. But as we start to look forward at the care of young patients, and we're seeing more and more patients, for example, I've inherited many patients from Dr. Otten with MOG antibody disease who have gone from childhood to adulthood. What are some things for the both of you that you're optimistic about as we start to learn more about both family planning and pediatric to adult care for patients with these rare disorders?
I'll jump on the first portion of this question. So kind of like there's internationally, I would say, a lot of attention, not only about family planning, but women's health issues in general across the lifespan. And there's kind of like really big collaborations to learn more about women's health across the lifespan, including family planning. And for instance, there is a collaboration to learn about pregnancy-related information now beyond the MS. NMO spectrum disease, there's research with people who are interested in family planning can contribute. If there's some interest in that, we want to learn more about these medications. So that can be part of giving the part of your story. That can be samples like blood samples, breast milk samples, etc. All of that will help us to learn more. And I think there's a big initiative and a big push to get more information. That makes me very hopeful.
I am old enough that I've been practicing before we had MOGAD well described or even easily testable. And since I've been practicing, I've seen so many more antibody-mediated diseases have specific tests and be able to give patients more specific information about what to expect. And that just makes me more optimistic that as my patients move forward and as they get older, that their care is going to be better targeted to what they actually have, because now we're using less relapsing transverse myelitis, and we're able to give an NMO diagnosis or a MOGAD diagnosis in a way that wasn't true 10, 15 years ago. I think the number of drug treatments out there is also incredible compared to when I started. Especially for pediatric patients, we're always the last to have something tested. We're the smallest population when it comes to a lot of these disorders. And so it takes a while for medications to trickle down to pediatrics, but we have so many more choices to give families and patients to choose from. And that makes me really optimistic that the future of patients diagnosed today will just look a lot different than if they were diagnosed even 10 years ago. I think there's a lot of reasons to have hope.
Michelle, I'm gonna let you close us out because if you don't mind me sharing something from our conversation from when we were
Not at
talking
all,
about
go
this
ahead.
panel. So because you've already shared so much valuable insight for us, and I remember when we had the conversation, you said, I've been stable for a little bit. I don't know that I actually have that much of value to say, and I actually think that's quite the opposite because of everything you've gone through before you've gotten to that, thankfully, clinical stability that we see now. I am curious, for say a patient who is just starting this journey or is, either newly diagnosed or just experiencing something, for the first time. I mean, what are lessons that you wish you could pass on to that person?
Oh, that's a really hard question. I like to say that I went through it, but my parents lived it. Because for so much of what I went through, I was not aware of what was going on. Hospital visits, 14 months old. I have no recollection of, what had happened. What I'm able to tell you is just from the medical file I've had, hearing my parents talk, this is what we went through, this is what happened. And I think my mom makes a very good point. The biggest thing that people, I think, can take away is you have this rare autoimmune disease, but for example, in my case, I didn't receive any treatments at all. I had these year-long relapses, no treatments, and I still made it through. I'm still able to walk. I had constant blurry vision for a year, still no treatment. I'm able to see, but with corrective lenses. And, thankfully at the time that I was able to finally get diagnosed in 2017, there was a name. And in the other sessions, they told me, did you feel any grief or anything? I said, no, I was excited. I was like, I got a name. Let's keep going. Let's get the next step going. I'm ready to move on, get on with my life. And I think it's just realizing that no matter what disease you have, it's different for everybody. And that you can't compare yourself to anybody's progress. You can't, say, I'm sure you can look at people and be like, oh, they have it worse than me. I feel so bad for complaining. Don't complain. Everybody goes through it. Everybody feels everything differently. It's kind of like with pregnancy, Everybody says every pregnancy is not the same. I didn't believe it until I had 2 kids. Every pregnancy is different. And it's the same thing in life, and it's the same thing with these diseases. It's everything is unique to yourself, no matter the similarities. You just never compare yourself to anybody else, even if they have the same thing that you do, because everybody has different walks of life, and everybody, we can acknowledge and come together, complain, draw strength from each other, but you are in your own lane. The only competition you have is with yourself.
Yeah. We're each running our own race, and there is nothing I could possibly say that tops that. So I'm going to say let's call it there. So let's give it up for our panelists.